Good morning, everybody. Uh, Professor Shukla said I'm an industrialist from Ahmedabad. Not really, sir, in a big way. I'm running an SME. Okay. I'm a professional turned entrepreneur. Basically, I'm a chemical technologist with a diploma in management kind of thing. I've been associated with the Ahmedabad Management Association for quite a long time. And some of you are familiar with Ahmedabad Management Association, but just to brief, we are one of the best rated management association in the country for consecutively for last 15 years by All India Management Association. Even in these difficult days, AMA is trying to keep its flag up through so many webinars actually. We touch the lives of everybody of Ahmedabad, be it children to women, even businessmen, entrepreneurs, academy. We touch everybody virtually in Ahmedabad public. And most of us who are in Ahmedabad are everybody knows about Ahmedabad Management Association. A lot of credit goes to Mr. K.K. Nair. He has been with the AMA through his for a long time, and it is he who has really built the AMA, I would say, with the able leaderships of management committees, presidents, time to time changing. But in AMA, some of you must have visited also, I don't know. But you find a very encouraging kind of climate in Ahmedabad Management Association. I am also myself is a learner from AMA, okay, and strongly associated with for the cause of the management. So today I have the pleasure to be among your such a international grand faculty in front of me. I'm sharing the dais with those people. It's an honor for me, thanks to AMA. And I'm not here to lecture anybody actually. I'm here to listen all of you. And I was told by Professor Shukla that some of you are internationally known demographists like Professor Jain and even Mr. Padmadas. Okay. But we're all by and large living in a globalized world. So obviously, though there are few indications here and there looking inwards, but largely we're in a globalized world. So challenges are many for any management people. So today we have extraordinary faculty friends to deal with this subject, which is very complex, leading with all the management problems, be it logistics, be it finance, be it anything, marketing, be it currency, a lot of things comes in, even the taxation, a lot of things come in it. Sir, I have the pleasure to introduce our distinguished panelists today. It's a very brief introduction. Then I will request Professor Shukla to take over kind of thing. To begin with, Mrs. Jane Cecilia Buckingham is a professor of demography and international social policy at the University of Southampton. She is also Dean of the Faculty of Social Science at the University of Southampton and Director of the ESRC Center for Population Change. In 2018, she was elected President of the European Association of Population Studies, shortly called EAPS, and she was President of the British Society for Population Studies between 2015 and 2017. She was awarded an OBE for services to social science in the Queen's Birthday Honours for 2015. I welcome ma'am for today's webinar, and we are honored with your presence with such a distinguished academic interest you have, and welcome ma'am. Our next panelist today is Professor SabuPadmadas. He is a PhD in demography from University of Groningen, Netherlands. He is Associated Dean at the Faculty of Social Sciences, Professor of Demography and Global Health, and founding co-director of the Center for Global Health, Population Poverty and Policy at the University of Southampton. I welcome you, sir. It's an honor to welcome you today for this webinar, which is being attended by few international audience also we have. And then I'll move to our third panelist.
What I can do is to continue while Mr. Nair joins in is our third speaker today is Dr. RobAngell. He's a wonderful colleague, our Director of Internationalization at Southampton Business School, and also an associate professor in the field of marketing, where he has published in top tier journals. He has written a lot widely in public press, mainstream press, including some of his work on panic buying, particularly, and food waste was captured very recently in the UK media, including some of the top newspapers like Daily Mail and so on and so forth, when empty shelves is what we were seeing around. I think Mr. Rao is joining us back, but I just thought I will give that little introduction on Rob also.
I'm sorry, I lost the contact.
That's okay, Mr. Rao. So I've just introduced Rob, and we can move forward as when you are ready.
Can I, sir?
Yes, please.
Are you able to listen me?
Yes.
I move to you, Professor Shukla, sir. Yeah.
Please go ahead. Yes. Anyway, I'm sorry, but just for the audiences, yeah, please go ahead.
Professor PauravShukla is the Professor of Marketing, Southampton Business School, University of Southampton, UK. He is a management thinker, educator, researcher, consultant, and entrepreneur based in the UK. He is a Professor of Marketing at the Southampton Business School, University of Southampton. He possesses wide range of industry and academic experience with middle to senior level in healthcare and media industries. He has been delivering corporate training, teaching, and consulting assignments for various organizations in the Europe, Asia, and North America. He is the one who has a lot of experience, practical experience with a theoretical background. And I welcome you, sir, for today's webinar. And now you can take on, sir. Thank you.
Thank you, Rao, sir. Thank you ever so much. And thank you, everyone, for joining us. What I'm seeing right now is we have almost overall between YouTube, Facebook, and here, almost 80 participants have already joined us, which is fantastic to see. And from all over the world, I'm seeing names that seem very known and some of the unknown names. So please introduce yourself in the chat box also. That would be very nice. Some of you have done that. We will capture the ideas as we go along. The plan is that, first of all, Professor Jane Fockingham, in a way, I'm so eager to hear her, and she would start this session, and then Professor SabuPadmadas will speak then after. So we will have each 15 minutes talk on particular global management challenge, and then Dr. RobAngell will join us, and finally, I will provide some concluding comments. We will then open the discussion to the wider audience. We will have a Q&A, and we will conclude after the Q&A. So that is our plan for the moment. So over to you, Jane.
So thank you very much for inviting me today. I'm going to spend 15 minutes really talking about global population change and really trying to set the scene for my colleagues who are going to come afterwards. I'm going to start with a very, very big picture and then focus down on India as we go through. So really, this is a slide I show all of my students when I talk about global population change. And it's really to tell you all what an exciting time we happen to be alive during. So we happen to be alive at a period of time when the world's population is being completely transformed. So for the first sort of million years or so of the world's population, just really bumped along at about 100 million, or maybe slightly less than 100 million people, and then gradually started to rise as we moved into settled agriculture. You can see the dip of the Black Death and the plague in the 1700s, but it was really the 1800s where the world's population started to grow. And once it started to grow, you can see that that growth has really been exponential. And we're happening to live at a period of time where we're witnessing this and we're able to measure it, which I think is one of the really exciting things. Now, most demographers think that actually the world's population will start to stabilize at the end of this current century. So when we get to 2100, we'll have a global population of around 11 to 12 billion. So in 300 years, the world's population will have been completely transformed. So the first billion really took the whole of human history to about 1800. The second billion took around 130 years to be reached. Then the speed really picked up and we hit the third billion in about 1959. You'll see I've actually put a date on my table. Of course, we were getting better at counting people and we were getting better at estimating, but we don't really know it was that actual date. But we think the third billion member of the world's population was born in around October. And then the fourth billion took an even shorter period of time, just 15 years to go from 3 billion to 4 billion. And then another 12 years to go from 4 billion to 5 billion. Another 12 to go to the 6 billion. Then things are starting to slow down. And we hit the 7th billionth citizen of the world in October 2011. And world population growth is starting now to slow down. As a consequence of this change in population, the population, I tell colleagues, it's really simple to be a demographer. We only have to look at three things: fertility, mortality, and migration. And actually, if we're looking at the global population, so far we haven't been able to move on or off this earth and have migrants coming from Mars. So we really only need to understand changes in fertility and mortality. And population growth has happened because actually we've seen improvements in mortality, followed by changes in fertility. And one of the things I think we need to celebrate over the last 150, 200 years is really that we've actually moved into a much healthier world. And this graph just shows you trends in life expectancy across the last half of the last century and over the last 2 decades of this century. And you can see there have been improvements in life expectancy in all parts of the world. Again, an interesting dinner party fact: if we take the UK in 1901, the average life expectancy for a man was around 40 years. If we take 2001, the average life expectancy for a man was around 70 years. So that is an improvement of 30 years in a century. Let's just think about that in a little bit more detail. This is a bit naughty because we probably shouldn't do this as demographers, but that's 3 years in 10 years. Or that is about 3.5 months in a year, or 2.5 days in a week, or 8 hours a day. Improvement in life expectancy. And if you take the changes in life expectancy in any part of the world, you will get the same calculation that has been between 6 and 8 hours a day improvement in life expectancy over the last 50 years or so. So truly amazing that we're living in a healthier world, although Sabu is going to come on to talk about COVID-19 in a moment. The other thing that has been happening at the same time as improving life expectancy is we're living in smaller family sizes. So as the prospect of children surviving into adulthood improved, families have modified their behaviours, and we've seen dramatic changes in the total fertility rate across the globe in the last 50 years. So if I had been showing this graph maybe 5 or 10 years ago, we would have seen that there were only really parts of sub-Saharan Africa where fertility rates had remained high. But even in the last 10 years in say, for Uganda, you can actually see that the fertility rate has started to fall. So on average, they were having 7 children, and now it is down to an average of around 5 children per woman. But in many parts of the globe, this fall in fertility has happened at very rapid paces to very low levels. So you can see in Korea, for example, again, in the 1950s, they had around 6 children per woman. This has dropped down to around 1 currently. Now, actually, a couple needs to have 2 children at least for the population to reproduce itself, because 1 man and 1 woman coming together as a couple need to have 2 children. And these very low fertility rates that we're seeing in part of the world are causing real concern for many governments, because it means that their populations will start to shrink over time. If we look at India, you can see, again, most families were around 6 children in the 1950s, and today it is just over 2. And in some parts of India, particularly in southern India, actually the total fertility rate is less than 2, whilst in northern India it is slightly above 2. Of course, families are really important for businesses, because many products are marketed at families. And of course, family size is also important for determining the number of people going to school, etc. The consequence of these changes in people living longer and having smaller families is that the global population is becoming older. Now, this is often presented as a problem, but I think it's actually something that we should be, again, celebrating, because that change I showed you at the very beginning in terms of population growth, that comes with a restructuring of the population's age composition. And actually, it's a natural outcome of these demographic changes. So we are all going to have to get used to a world in which the global population is getting older. This might mean we actually need to rethink some of the things, the ways in which we define old age. So this shows the median age of different parts of the world in 2010 to 2050. The median age is where half of the population is older than that age and half of the population is younger than that age. And you can see that in Asia, by 2050, 50% of the population will be aged over 40. So this means we might need to rethink ages of retirement. We may need to rethink the ages at which we enter the labour market. All sorts of changes will come about from that. And here I'm drilling down into the median ages of the world's most populated countries. We'll share these slides later, so you don't need to write them all down. But again, you can see here for India, its currently median age is around 28. By 2050, it would have risen to 38. So a rise of 10 years in the average age of the population in a relatively short space of time. One of the measures that we look at in terms of thinking about aging populations is the seniors dependency ratio. So this is the number of people aged 20 to 64 divided by the number of people aged 65 and over. 20 to 64-year-olds are thought of in some way as workers, and 65 and over are thought of in some way as dependents. And you can see there's going to be a dramatic decline in the number of workers per older person in India. It's going to pretty much halve in a 40-year period. But of course, that means that we're still thinking of people aged 65 and over somehow as being dependent, whereas people aged 20 to 64 are somehow workers. And this is a challenge out to you all to maybe rethinking what we mean in terms of old age and whether chronological age is really the measure that we should still be using. The So we're getting healthier, we're having smaller family sizes, we're getting older. And the final trend I want to draw attention to is we're also becoming increasingly urbanized. So with migration, more of the population right across the globe are living in urban areas. So in the 1960s, across the globe, urban population accounted for around a third. Today, it's just over half. And by 2050, it will be over 2/3 of the population living in urban areas. And not only are we living more in urban areas, but we're living in bigger and bigger cities. So it's not just we're moving into urban areas, but we're tending to live in urban agglomerations. And this map just shows you where the largest urban agglomerations are, and they happen to be concentrated heavily in Asia. So actually in India, you have 1, 2, 3, 4, 5, 6, 7, 8, 9 of the biggest cities in the world. And again, these are just showing you the data, so just focusing in on India. You can see by 2050, over half of the population will live in urban areas. So thinking ahead, you'll remember I showed you when the billions, we hit the billion population landmarks. At the moment, we think the world's population will reach around 8 billion in 2025. Then we'll go on to 9 billion in 2043 and 10 billion in 2083. But of course, projecting things is a very uncertain science. So we have a pretty good idea. This data we think is pretty accurate, but we start to become a little bit more uncertain. So this red line is the central projection from the United Nations. But if we have half a child more, that's what would happen to the world's population. And if we have half a child less, that's what will happen to the world's population. So there is a possibility we will end this current century with a world's population of 15 billion. But equally, we could end this century with a world's population of around 7 million or even 6 billion. So a lot depends on what happens to our fertility and our family building behaviours. What does that mean for India? This is the population projections from the United Nations for the Indian population. You can see that it's fairly certain that the Indian population will reach 1.5 billion, which is a lot of people. But then there's a lot of uncertainty as to what will happen going forward. The best guess is that the population will continue to rise until about 2060, and then will start to fall off. I'm aware that I'm talking to a management school and you're interested in business, so interested to see what happens to different groups within the population. And I think that this is really interesting, that actually the working age population is going to peak around 2050 and then will start to fall. The number of children in the population is already falling. And you can see that actually the number of people aged 65 and over is going to exceed the number of people aged 0 to 14 later on in this century, which does mean we need to rethink our markets. We need to rethink who we're producing for, what are we producing, what are our target audiences. Again, thinking about where people live, you can see that the percentage in urban and rural areas is due to crossover in around 2045. So we tend to think of India still as a rural dominated country, but actually the urban population is already nearly equal to the rural population, and they will be crossing over not too distant future. And again, we can see the rise in the number of cities, and you can see by 2030 there will be 7 cities of 10 million people or more, which again is a real challenge out to us. So what does all of this mean for you? It means that we need to be aware of the changes that are going on in our population and the changing markets. There'll be more metropolitan living. The trend to smaller families is set to continue. We need to rethink the workforce. We might need to think about skilling the workforce, not just once, but more than once, 2 or 3 times. If you're actually going to live to be 80, retiring at 60 is probably not going to be an option, but maybe having a new career, maybe thinking about changing your careers, getting a new set of skills. 2 or 3 times over. I couldn't have imagined when I started work that I would be sitting in my office in Southampton, talking to a computer and giving a seminar to colleagues all over the world. We're having to learn new skills every day. The good news is we are going to be living longer. The big question mark is whether we're going to be living healthier, and Professor Padmadas will be talking a little bit more about that. And in terms of future world population growth, going back to the chart I showed you on the number of children people have, I think all eyes will be on Africa going forward. Africa is the only part of the globe at the moment which still has rapid population growth. And the big question will be what happens in Africa over the next 20 to 30 years. Thank you very much.
Most fascinating, Jane. Thank you ever so much for this wonderful presentation. Again, it shows us, in a way, we will take the Q&A, as we have said. If you have questions, please drop them in the Q&A box, and we will take them forward once all the presentations are over. But I think it shows us the grand challenge that is facing us, in a way, because many a times looking into the present, we sometimes forget how the future is going to look like. And it is so unpredictable right now. And I think this is most fascinating. So thank you ever so much, Jane. And moving on to Professor SabuPadmadas, as Mr. Rao introduced him. Sabu is a wonderful colleague and at University of Southampton. And he's also, probably some of you may not know, but he was one of the pivotal actors or pivotal researchers in changing, in some ways, the one-child policy of China. And the work he has done with governments and with many supranational entities, including United Nations and World Health Organization and others, the way he's connected. We are looking forward to hearing your fascinating views on world challenges. Go ahead, Sabuji.
Thank you, Pauraji. Thank you. I'll just share my slides. So is this clear? Yeah?
Yep.
Right, brilliant. Thank you. And I think, that was really a grand introduction from Professor Jane Falkingham. Came to Ahmedabad. Namaskar. I'm really delighted to be back at AMA, and this time on a virtual platform because of a life-changing pandemic, as you know. But I hope you and everyone at home are safe and keeping well. So my presentation, as Pauravji was mentioning, today will focus on the health sector impact. And as all of you know that health systems are not really designed to face a pandemic of this nature or a scale or impact. Because the vast majority of health workers, if you look at, for instance, from nurses to allied health workers to even physicians, they have at the start of the pandemic, they had no idea of the nature of the pandemic and the virus. And this is not just in the case of any middle and low income countries like in India or other parts of the world, but also globally, including the UK, US, and many advanced economies where chronic and non-communicable diseases are dominant. So chronic diseases and non-communicable diseases also include diseases like heart attacks, strokes, cancer, and so on. So for example, within the next 25 years, the global diabetes is projected to increase by almost 50%. And that is phenomenal. And with both India and China having over, I think, about 100 million diabetic patients, and that's really going to be quite challenging. And this is this is mainly because of the unprecedented rates of population aging in countries, including India and China, as Professor Jane Falkingham correctly pointed out. I mean, I think, this is very, very crucial. I mean, when we discuss global management challenges, how the population structures are changing and how the disease patterns are changing are very, very important, very crucial for the survival and well-being of the population. And also we know that, of the, roughly every year, about 58 to 60 million people die globally. And among all these deaths, if you take, for example, almost 3/4 of deaths, that is about 70 to 75%, are attributed to non-communicable and chronic diseases. And that's really extreme. And where do these happen? These happen mostly in low and middle income countries. And there is also a shift in the pattern of the diseases, such as heart diseases and cancers and so on, as the diseases seem to be more prominent among young people. I think this is something that is very, very important. And these are the populations that are expected to be more productive, and contributing to the economy and so on. So my questions are very simple. How did the healthcare systems reconfigure and cope with the COVID-19 pandemic? And what are the main challenges? Because, of course, we know some of these challenges, but can we really, reflect and see that how the health systems coped over the last couple of months? And what can healthcare systems do to better manage the pandemic and minimize the mortality burden? Because a pandemic of this nature, of an influenza pandemic, may arrive at any time. I think there is no doubt about that. So the question is also about how best we are going to be preparing for the future. So, this is something that, my colleagues would know that I gave a presentation on the, I think in March, on the 13th of March. And at that time, globally, the number of cases were about 128,000 positive cases, 4,000 deaths. It was initially spread in around 114 countries. And that was 74 days since the pandemic started. That is actually on the 31st of December, 2019. Now, look what happened. When I started teaching my own students, on the Thursday, the 8th of October, I gave a lecture, and there, it was already about 36 million positive cases. And now, within the last 12 days, it has gone up to 40 million cases. And that's literally, about 65 to 70% of the Gujarat population. That's the size, the scale. Deaths, incredible increase in deaths. I think these are really the number of deaths that have increased attributed to one single virus, 1.12 million deaths, and affecting almost all across the world. I think there is no country that is immune to COVID now at this point. So if you look at, this is just a quick, most of you know this graph, but I just wanted to really reiterate that these are the number of cases per million people. So, per million people, if you look at India is somewhere here, but on the top, you see United States. This is actually a country with a very, well infrastructure, health infrastructure and so on. Brazil, I think, well, we know that why that really actually increased because of the initial denial of the pandemic. That happened in many places because nobody knew the existence of this particular strain before. And then, of course, Spain, France, and all these developed countries, developed economies, including the United Kingdom, UK. UK is now really experiencing a second wave at the moment, and that's natural. So, for India, I think, it's now the cases are really have started to, go down a bit, but it all depends on the testing as well, because testing is very, very important, because without testing, we don't know actually whether people have have the infection. So it's very important that, but also India, I would like to really make another point, is that it's all equated per million people, right? So if you look at the whole population, the entire population, it can be really huge. And the share of deaths actually currently, India is predicted to really even overtake US. So India is somewhere here, as you can see that over the last 3 to 4 months, 3 months particularly, I think we have seen that an increase in share in the number of deaths. I think that's astronomical. Because I think we also know that there is the mortality in India, as well as in many other parts of the middle income countries are grossly underestimated, because I think there is a lot of underestimation. There is lack of reporting of deaths attributed to COVID. There were people dying without knowing that they had COVID and so on. So what do we know so far is that this is a highly contagious virus. This is mostly mild or asymptotic. That is the interesting nature of this virus. But the infection fatality rate is confirmed to be much higher than any seasonal influenza. Seasonal influenza, every year we get some kind of viral fever and so on, or a similar kind of fever. But this infectivity rate is very high. And also particularly in the second wave of the pandemic, I mean, many countries will experience a second or even a third wave or even a fourth wave, because that's how because the virus has gone beyond certain points of control. And long-term health challenges, I think that's another thing that's probably not really well understood. Research, science is really behind it, really understand what are the long-term effects. So there is evidence that people who have had this COVID, 6 months back are still recovering from the lung health, respiratory health, and so on. So respiratory systems, digestive systems, and lungs, and even other organs up to brain. I mean, it can even. There is evidence of really COVID influencing the brain because of lack of oxygen supply to people with underlying health conditions, because that's another challenge that we have. Because, I was referring to India, the diabetic epidemic in India. I mean, that's really one of the underlying conditions that could really worsen the exposure and the effects of this virus. So there is no vaccine at the moment. There is no vaccine. So when will this come? I mean, that's a big question. That's $1 million question. But it is expected that this is not going to. It's going to really take another a year, a couple of months, 100%, but also probably a year. But it may happen early, because the world is really, and the world has moved on. I mean, in terms of really understanding the nature, the RNA structure of the virus, and so on. So very soon we may come up with a vaccine. But at that time, what we need to really ensure is that this virus has not mutated into a new strain. If it is mutated into a new strain, then it becomes another challenge. So from a health systems perspective, even if a vaccine is made available, we have to first ensure the safety in human beings. I think that is going to really take time. So that particular aspect is actually, unfortunately, a little bit bleak in my personal opinion. And there is also age shifts. This is actually from Belgium data. You could see that, well, initially, I think when the pandemic literally, affected all of the European countries, this was the age distribution. And then we see, when the first wave started slowing down, it was actually affecting young people. And then now the second wave is very clearly that there is no question of young people as well as young adults or even children being affected by COVID. Now, we have all these measures, social distancing, 3 to 6 feet, that's about 2 meters, that is pretty standard. This is something that is very logical, that it has really, there are now research studies that have proven the effects of social distancing, wearing masks, and also keeping all the hygiene measures like hand washing and so on. Because, when we talk, for example, so because the virus spreads through aerosols and, like kind of droplets in the air. So it depends on the intensity of how you even speak. So for instance, if I speak loud, then, the spray will be much wider. So that means and we are actually, in that spray contains millions of these small particles. And there, if this coronavirus is there, then, you are at risk. So I think what we have been trying so far is actually to flatten the curve, flatten the epidemiological curve, flatten or reduce the mortality burden. And that's very important, because we need to save the lives of people. And the only way to save the lives of people is to really reduce, is to contain it, and also reduce the number of cases, as well as reduce the mortality burden. And testing, tracing, rapid testing and contact tracing and isolation, these are really excellent measures that have at least contributed to reducing the burden of inpatients in hospitals. Now, when we talk about health systems priorities, I think the first and foremost, especially in a pandemic of this nature, is is to ensure safety measures. That means like reducing transmission risks. So that becomes a significant challenge for many hospitals. And in India, of course, we have a combination of private and public hospitals, and sometimes small clinics not even really understanding what to do especially at the start of the pandemic. But now there is probably a much better awareness of COVID. Now, severe disruption of routine healthcare workers, and that was really tremendous because that affected a range of chronic diseases and non-communicable diseases. So next year, within the next 12 months time period, we will have, so the probability that all the NCDs and the chronic conditions will really increase by 50% is almost 100%, because that's definitely going to happen. So general health services were badly affected. Pregnancy services, many women were pregnant. They couldn't really get essential services. Because of the pandemic, and also they couldn't really even get screening or antenatal care and so on. So maternal mortality, for instance, could be much higher. Mental health, not really very well discussed, but that's something that we will, it has. Already there is some evidence, but we will get to know more about it. And maternal and child health, particularly, I think that's actually both the mothers and children tend to be vulnerable. I think. So the COVID has had a massive impact on that particular thing. So I'll just take the next 3-4 minutes to really touch base the main thing, and then I will conclude the presentation. So according to the World Health Organization, conducted a survey of nearly all countries, but about 153 countries, I guess, responded to the survey, and they reported service disruption for hypertension treatment by 53%. Diabetes by 49%, which is actually all about management. These are chronic conditions where the only way is to really manage the condition. And sometimes, many countries, particularly, I think those countries which are resource constrained and low income countries, were badly affected. Cancers and cardiovascular emergencies really got affected by the disruption. And then the other challenge is the reassignment of health resources. So there is already a shortage of health workers that we know, but also training becomes a big challenge, because how do you really ensure that the health doctors and nurses and the whole health system is trained so that A, to understand the nature of this virus, B, also to manage and treat the patients who are walking into the health systems all the time. Excuse me. There is also equipment and infrastructure prioritizing acute care. So there has been a shift from non-essential or non-acute care to acute care, and that really created a damage. And it also really required millions and millions of supplies, essential personal protection equipment supplies, like, for instance, 89 million masks in the world. That was the projected figure per day. So this is actually, per month. Every month, we require something like 89 million masks around the world, 30 million gowns, and 1.59 million Googles, and 76 million gloves. And these are not that easy to really manufacture, especially during this particular time period. So it really badly affected the healthcare supply chain. And the main challenge was actually clearing bottlenecks to address the supply shortage. I think that was really one of the significant challenges, because it's like, and India, fortunately, India has this advantage of this, being in the forefront of pharmaceutical development, research and development. So even then, initially, and for India, I think because India had sufficient time before the cases started increasing to see the rest of the world, what's happening and so on. So at that time, there were productions. China, of course, seized the opportunity, and you saw that a massive economic productivity, and particularly in health related markets and so on. So increasing production capacity was another challenge, and innovative solutions were required for extending manufacturing capabilities, and I think that was another big challenge. So I'm not going to spend some time, more time on this, but this clearly shows that what this shows is that the light green shade is actually the healthcare workers on the COVID-19 wards. their seroprevalence or the antibodies was actually significantly higher than someone who were really giving a blood or some general healthcare workers. So that was very clear, and it affected literally all wards from respiratory medicine, hematology, infectious diseases to up to nephrology, dermatology, and psychiatry to gastroenterology. So that is really, it affected literally wider kind of departments. And this, I think you very well know that, well, the diabetes that I talked about, this was the 1990, that was the case in India. And this now in 2016, one point to really highlight is about the diagnosis and reporting and so on. So Kerala, of course, Kerala and Tamil Nadu have higher rates of diabetes. I mean, part of the reason is also attributed to healthcare systems, which are really good. And also people have that health-seeking care behavior. And in fact, so diabetes is actually widespread in these populations, perhaps in all across the world, all across India, and Gujarat is no exception either. But we know that, well, so that is actually quite a big challenge, especially when we deal with this pandemic. Then the final point is regarding the rural healthcare systems. I think they were completely ill-equipped to really manage this pandemic. And because of migration that happened, well, Professor Jane Falkingham mentioned about the migration flows, and in fact, I think the migration over the last couple of the internal migration from cities to rural areas and villages over the last 6 to 9 months have been unprecedented, especially in India, and that we know that well. And so there is actually an expectation of a rural surge of COVID cases in India in the very near future. And this is just to really show the migrants queuing actually to find their way back home to their villages because of loss of jobs and so on. So it really massively really affected. So finally, I would like to really end the presentation by highlighting these key points. So I think globally, World Health Organization, I mean, they did their best, but I think they could have done more. So this is the question, this is the point that applies to almost all nations. So what we have seen is actually, there was a lack of public health leadership and health emergency management. We are probably good in managing floods now, but not really, and we have never thought that COVID, a disease like COVID would really, make a huge impact. Second one is actually resource mobilization in a short period of time. So this is actually reflected very much in what is known as the WHO Ottawa Charter, which clearly highlights certain ways that you can actually manage the pandemic. And these are all related, these apply to health systems. And of course, effective and methodical coordination. It's not just coordination by just simply passing on messages, but also follow up, making sure that really reaches out to that every point. And at each point, you also would need to really install what is known as a kind of a resilient approach, like to be more resilient and manage the local circumstances as well. So from global to national to local level coordination is fundamental, paramount. Data monitoring and surveillance, I think that we know that will extremely important. Without data, that we won't be able to really understand, and we will be in complete darkness by now. So that's very important. Communication streamline, I would say that this is very, very important, and culturally appropriate communication. So when you go to a rural migrant, who has probably done only a few years in school, and talk, give him, so when we try to educate them about social distancing, they may not understand. So you will have to really, come up innovatively, like with new marketing strategies to really, and health marketing is not just really marketing the different treatment options, but also educating the public, and that's very important. And public-private partnerships, very, very crucial for India because of the dominance of the private sector in the country in the delivery of healthcare, and also for a big nation like India, we would need to really undoubtedly. The budget would need to be more budget. So it's at the moment it's about 1.52%. That's really very, very low. I think in the future that would need to be reflected more carefully. And research and development, I think we have talked about it. That's very, very important. Finally, telemedicine, remote diagnosis, treatment, and follow-up. I think India has this potential, this great potential. So, for example, in 2005, the NTT, the National Telemedicine Task Force, was formed. Ever since, India has been a champion of telemedicine. And we would have, I mean, of course, I don't mean to say that this has not happened. It has happened, but it didn't really happen to the scale that we want. And there were plenty of opportunities in front of us actually to really make the best use of this. And it is actually a multi-billion-dollar industry. I mean, as you can see that over time in India, particularly, and across the world, I mean, India, this is actually pertains to the Indian data, and it is really evolving over time. So I think I would like to stop here because I don't want to really take much time, but I just want to conclude saying that pandemic influences are very complex. They are imminent, clear, present danger, and unpredictable. So they are actually inextricably linked to our physical environment and anthropogenic behaviors. That means human behaviors. So it's very, very important. This has given us a wake-up call actually to really think and reflect more sensibly. And the question about the future is that, well, they will re-emerge in new mutated states, because since the start of this century, we have seen more of these infectious diseases coming out, like SARS, Ebola. Ebola happened, for the second time. If Ebola had not happened if Ebola had happened in India, then it would have been a pandemic by now. But it happened in 3 isolated countries, Guinea, Liberia, and Sierra Leone. So the impact was less, for the rest of the world. But so it will have an impact on our lives and livelihood. And I'd like to stop there and thank you for listening. Thank you.
Thank you, Professor Padmadas. This was really insightful in terms that you captured from what Jane had stopped, that, India is sitting in this state of population change that is about to happen, to now going into a scenario wherein, the health system is going to struggle in different ways in different countries. And I think that was really exciting and in some sense, a very fascinating global challenge that we are going to face and continue to face. Now we are moving to a different domain. And Dr. RobAngell is going to talk about, us as consumers and why we make such decisions as we do and what drives us to make those irrational decisions. And so over to you, Rob.
Thank you, Professor Shukla. Wonderful presentations by Professor Padmadas and Professor Falkingham. Very enjoyable. And I can safely say that I benefit on a daily basis from my colleague SabuPadmadas, and we spend many hours talking on the phone about the pandemic. I'm going to move into the domain of marketing now and talk about consumers. Now, I have the great privilege and joy in my job that I've been able to, over the last few years, spend my time researching and looking at the way that consumers make decisions. And in my world, I have come to the conclusion, like many of you will have done as well, that in many cases, consumers, like you and I, behave irrationally, okay? Now, also as part of that revelation is the importance of context. Now, this is extremely important and becomes one of the central components of my talk today, which I'll also link to the pandemic. Now, context is important because we all, as humans, have a tendency to evaluate other people based upon what they do as being a direct antecedent to their or consequence of their personality. Think about this. If you see somebody behave aggressively, you automatically assume that that's because they're an angry person. If you see somebody who's talented, you think, wow, they must have had a great upbringing and background. There is, of course, though, another side to this, and that's the issue, and that's the side of context. Let me just put this into a little bit of perspective. So imagine this as a scenario. You're driving home from the office through Ahmedabad, and we know what the traffic's like, and you observe a minor car accident on the roads. There are quite a lot of cars ahead of you who must have seen it, but no one stops. What is your instant reaction? I'm guessing your instant reaction will be, wow, there's lots of selfish people who are out tonight. Now, you, being a kind, considerate person, you think about stopping. But you quickly have a look at your watch or the clock in your car, and you realize that you're running late for another meeting or a family commitment, and so you continue on your way. Other people, it's because of their personality. You, it's because of context. But what you don't know in that situation is what was driving them to behave in the way they did by moving forward. There's a really to make this more concrete, there's a really famous illusion, I'm sure many of you know it, the visual illusion, by Professor Ebbinghaus. It dates back to the 1890s. And if we look at the screen here, we have two orange dots. And if we look at those dots, we can conclude that they're roughly the same size, the same shape, same color. But if I change the color, the context slightly, now I'm guessing you're seeing, like most people, the one on the right being slightly bigger than the other. But it's not, it's the same circle. So just like there are visual illusions, so too there are cognitive illusions. And cognitive illusions are often the things that are behind irrational behavior. Now, the thing is, the word illusion is a little bit misleading, because cognitive illusions, when they are known, like cognitive biases, they can be leveraged by marketers for their advantage, for better or for worse. And when they're known by consumers, well, we're in a position then to be able to make better decisions. And that's really where I'm going to go with this presentation. I want to reveal to you a specific type of cognitive illusion, what we call a cognitive bias, that we'll all exhibit in ourselves. We'll be able to see it in other people. And hopefully by the end of the presentation, you'll be aware of it and you'll be able to make better decisions as a result. Okay. In particular, I'm going to deal with the challenge of why news of potential stockouts will drive actual stockouts in reality in stores, and why as consumers you'll end up buying more things than you planned to. At the beginning of the pandemic, in around March, mid-March, there was a survey released by Numerator in the States. They asked around 3,500 people how the pandemic had shaped their behavior and changed the way that they had been shopping. Now, 73% of the sample, they suggested that they'd experienced product shortages in stores that they were trying to buy from. The second way that people had been impacted was that they had found that they'd been stocking up on products that they otherwise wouldn't do. Now, that's a useful correlation to think about there in the first instance. Now, whilst there are many things that possibly drive this behavior, to drive this outcome, from supply chain practices through to simple supply and demand dynamics, my perspective, my hypothesis is behind this dynamic is another cognitive bias. Okay? Now, imagine the following situation. And what I mean by that is that there is a cognitive bias that's also impacting and propelling these outcomes. Now, I'm sure many of you can identify with the following scenario. You go to a cafe or a restaurant, coffee shop, and as you enter, you decide to yourself that you're going to have a nice sweet pastry with your drink. As you approach the counter, you look into the counter that has all of the sweet treats displayed, and you notice that although you don't normally eat cake, one of the products on display, a beautiful cake, has only got one piece left. What do? Well, if you're like my wife, you change your behavior and you choose the cake because there's only one slice left. Same kind of scenario whenever we go to a restaurant. She wants to go and have a chicken in the restaurant. When the waiter comes over, the waiter says, "These are the specials. We only have 1 or 2 portions of salmon left." And she quickly changes her mind and she goes for the salmon. Does this strike a chord with any of you? If it does, then you are not alone in the slightest. A really famous study by Stephen Vorschel at the University of Virginia tested this exact same effect. Vorschel invited a number of participants along to his laboratory, and he asked them to sample and trial a batch of cookies that had been baked. Now, the experiment that he conducted split his sample into two groups randomly. Here's the kicker. Here's the main part of the experiment. The first group, randomly assigned, they received their cookies in a cookie jar that only had 2 cookies in it. It was relatively empty. The other half of the sample, they received their cookies in a cookie jar that had 10 cookies. It was full. He then asked both groups, how attractive did you find the cookies? How much did you like the cookies? And importantly, how much would you pay for the cookies? Now remember here, if they were acting rationally because it's the same batch of cookies made with the same ingredients, they look the same. If people acted rationally, there shouldn't be a difference between the way they rated these cookies. The only thing the difference differed was the number of cookies in the jar that they saw. But there was a huge difference. The jar that only had 2 cookies in was rated by the participants as being more likable, extremely more attractive, and therefore more tempting, and people were willing to pay 11% more for those cookies, representing a higher price tolerance. A really important finding. What's driving this effect? Well, as the famous psychologist Robert Cialdini would say, it's the scarcity heuristic. And this is determined by the fact that humans, like you and I, tend to place a higher value on objects that are seen as scarce and a lower value on those that are in abundance. This is why we pay thousands of pounds and rupees for diamond rings, and we actually assign no value to rocks. Rocks are in abundance, diamonds are very rare, okay? Now, whilst this might seem like a quirky, fairly interesting example, the implications of the scarcity heuristic can spill over into areas that are uncharted and potentially have consequences that we don't see as pro-social and can be very problematic in themselves. For instance, at, again, the height of the pandemic, before we went into lockdown in the UK, there was a significant problem that the supermarkets were experiencing. And Professor Shukla alluded to this in my introduction. They found that they had very, very limited supply on their supermarket shelves. Consumers all around the country were ostensibly engaging in panic buying. Things like that were essential, like toilet rolls, antibacterial soap, tinned products, all of the essentials were running out in vast quantities. And this was causing a problem for the supermarkets, not only in their supply chain practices, which was significant, but also in the negative press they were receiving from the general public. There were multiple stories of key workers, doctors, nurses, teachers, carers, who after a long day caring for the nation would go to the supermarket and find that there was no supply of the things they needed. The government even waded in and got involved as well. And together, the supermarkets, the government, and the media, like the BBC, encouraged, through pro-social messages and articles, the consumers of the nation to refrain from panic buying. And they emphasized the point that supply was fine, that there was going to be enough to go around everybody. The problem was, at that time, panic buying amplified. It went up. So despite the messages, people went and did more panic buying, and the situation got worse. Now, my co-author and I, Dr. Ben Marder at the University of Edinburgh, we had a hypothesis that behind this trend was potentially the scarcity heuristic, which had been found in behavioral economics and marketing research for a number of years. See, The messages that the media were relaying to the general public focused on these kind of taglines such as "there's no need to panic buy" and that there's great reassurance from supermarkets and that their supply chains are right and okay in the longer term. But the imagery that accompanied these pro-social messages, if you like, tended to depict photos of empty shelves. So we put this to the test. We recruited a sample of participants and we randomly assigned them to two groups. Both groups received exactly the same article with these kind of messages. The first group, they were depicted pictures of full shelves with people having ample supply to choose from. The second group, on the other hand, they had pictures depicted of the empty shelves which the media were using. If people were being rational and the scarcity heuristic wasn't in play here, then actually we shouldn't see a particular difference between these groups, but we did. In essence, the people who were exposed to this article, this stimuli, they responded by saying that they would be 83% more likely to intend to panic buy. And they were willing to part with more money than the other group when they visited the store for the next time, just in line with the previous experiment by Warshaw. Now, the question here is, how does the scarcity heuristic play a role? Well, it's a little bit like the way that social proof plays a role. We are taking our cue all the time from other people. In the imagery here, we see that other people have acted in a certain way. It means that there is value attached to the items that are no longer on those shelves. And we make sure that we stock up on those items that are in short supply, just like other people have, because they have a higher value to us and will have so in the future. Obviously, this is a dangerous consequence of the scarcity principle or scarcity heuristic in practice. Some of you might be thinking that this makes sense in an offline setting where we can see pictures of stock. When we go to a store, we can see how many products are on display. When we see pictures like this, we can see the effect of empty shelves. What about in an online environment where we can't see piles of products on the shelves? Well, retailers have also found ways of activating the scarcity heuristic in those situations as well. And I warn you to be careful and cautious when you make decisions, when you see advertisements or product displays online that talk about the amount of stock that's left in store. Like here, only 1 in stock, hurry, low quantities available, only 7 left. Those are ostensibly triggering the heuristic principle and encouraging you to potentially buy faster than you otherwise would. I hope now that you can use this information to make better decisions in your life, as I mentioned at the beginning of the presentation. When we know about the irrationalities, when we know about the cognitive biases that affect us, they are useful as leverage for marketers, but they're also useful for us as consumers so that we can make better decisions, more effective decisions in what we do and what we buy and how we behave. Thank you very much. I'll hand back over to Professor Shukla.
Thank you very much, Rob. This is so fascinating. And in some sense, number of questions would emerge, I'm pretty sure, once, Jane and Sabu and you join into the panel when we have questions. A number of questions are already popping up in the Q&A. So please continue to share your questions. I would want to do a little summary presentation around some of these thoughts and few takeaways for those who are with us in the business management field and particularly in the management, strategic management and marketing field. So Rob, if you just thanks very much by stopping to share your screen. I'm going to share my screen and I hope to take you through about a 10-minute little presentation on on some of the strategic management takeaways. And using that, hopefully, you can build better organization for yourself and for your company, as well as for brand, and so on and so forth. So I want to just touch upon COVID-19 in particular, as we were talking about, but I don't want to stop at COVID-19. Because as Professor SabuPadmadas and as Professor Jane Fockingham mentioned, that there is much beyond COVID-19. Those challenges are there, and we need to really think about it. And when you think about them, when I start kind of thinking on these topics, what I see is there are three kinds of organization. There are organizations, they have a mindset of that we are stuck, we cannot do anything. Many airlines, many hotels, many manufacturing businesses have thought about that. There are organizations who feel they are stuck in the sense that they can't maneuver because of either government policy decision or local or regional policy decision or some sort of lockdown coming in, such as services businesses like gyms and barbers and restaurants and so on and so forth. And then there are some organizations that are striving, such as what I would call retail organizations and logistics organization and digital organizations and so on and so forth. Now, the thing I would like to mention is that in every of these phases, in every of this type of organization, there are really interesting organizations within India that have actually shown the way forward. And I think that is something what we really need to focus on. Is, for example, companies like Hula. I don't know if you know Hula Global. Hula, you may have heard about that Hula Stick, which is kind of a competitor to Netflix and so on and so forth. I'm not talking about that Hula. This is a Delhi-based apparel manufacturer. It was struck. In a way, lockdown had happened in Delhi, manufacturing was not allowed, and so on and so forth. And so they actually pivoted on their business because they knew they had expertise in textile. And I think Ahmedabad and textile, we always associate Ahmedabad is still known to be the Manchester of India, as we used to put it. And so they pivoted and moved that textile expertise into the field of PPE manufacturing and did phenomenal business. In a way, they are no more struck, they are striving, and they are a manufacturing business. Let me tell you about Whitehead Jr. I'm pretty sure many of you have heard about Whitehead Jr. and Karan Bajaj and his company, which is bought by Baiju for $300 million while this pandemic is going on. And what does it teach? It teaches coding to kids. And so again, what you're seeing is a service business, which was once upon a time finding it very hard, has pivoted and actually used this. I have seen other examples of learning platforms which have actually not done that well. So they are stuck while there is a striver among them. And what did it do? I think that is a case in point. And similarly, there have been a number of companies, like I talk about this Delhi-based company called Sri Shakti Enterprises. This is almost a 2-generation-old steel manufacturing, steel utensils manufacturing business, which has pivoted completely to actually produce hands-free washing systems, automatic food sanitizers. This is an unbelievable indigenous innovation, food sanitizers, because we don't think about them. But in India, we want people to put their shoes away or outside of the home or at the entrance of the home and then come in. And so food sanitizers is what they've developed. There are a number of other companies, and what I see is that in each of these categories, companies have pivoted and moved on and taken on this challenge. And if they can take on this short, sharp challenge, then I think what we need to think about is that recession that is coming. A global recession is coming. We know that because of these lockdowns and all that, a number of businesses have shut down. A lot of millions of people are out of jobs. The unemployment rates are going up. That is a big challenge that is coming to us. And at that point in time, we really need to think about, how are we going to deal with that recession? I'll talk about another example of how another company in India is pivoting. That is a company called Workshala. And what it had was it's a workspace solutions company. So what it does is it provides common workspace to companies which are not big enough to buy their own premises. And it is such a fascinating idea, which worked till COVID did not arrive. But as COVID arrived, the company used its assets, that is the furniture, and provided it to those companies which were renting its space by saying that now we are helping you work from home. And so they changed their business model altogether. And when companies do that, they'll be able to manage this phenomena. The one point I want to make around this is that you need to invest in your brands right now. The evidence that we are seeing is a lot of companies, as usual, are cutting down their marketing and advertising budget. I'm not saying you should not cut, but with this recession, an important aspect, and you can see this in the chart which is on the right hand side, that when we compare the last recession that happened in 2008, and if you look at the MCSI index, which kind of covers about 1,600 companies, large and mid-cap companies across the world in 23 developed markets in the world, and we compare the S&P 500 index versus a brand Z index, which is run by Millward Brown, what you find is that brand, in a way, if you have a stronger brand, you come out of recession faster. You come out of the recession stronger than all your competitors. And I think, again, this is a very important thing you need to remember, that as the population is changing, as the markets are changing, the need to connect with your customer, as Mahatma Gandhi said, a customer is not just a visitor, and they are doing us a favor by coming to our premises, not that we are doing a favor to them. And so I think that service ethic need to be strongly embedded in your organization. We are seeing again and again research that is showing us this particular phenomena, that recession, in a way, putting customer relationships first in recessionary times drips you about, massive rewards when those recessions are over. And we are seeing that again and again. In a way, this chart again shows you, I can expand on this forever, but the idea is that the more you invest, the advantage you get is in multiple factors. That is most important. So I just want to summarize, like I said, I want to summarize some of these things to you, and then we open it as a Q&A for all of us. And the final thing I want to talk about is, how do you deliver real value to your stakeholders? And the question you need to ask, and this is something what you can take home today itself and do it with your organization or with your institution, is that what is the real value that you're delivering? And there are, most of the time, what we think is that, people only buy cheap products because people are price conscious. I don't buy that. Because if that was the case, we will all be driving Nano, which I'm pretty sure you're not. We will all be still cycling on a gearless bike, but we are not. And so the thing is, people do buy what they think is the best value for their money. And so you need to think about what value do you provide. And a lot of companies actually think about the top left value only. And in times of COVID, in times beyond COVID, you need to think about what is it that your product or service provides. But you need to move a little forward, and you need to ask, what experiences do I provide? When people come to my premises, is my premises welcoming? Is my product welcoming? Is my service welcoming? If people are connecting with you via your website, is your website professional enough? If people are calling your organization, is your call professional enough? Are they getting what they're expecting? Those are the kind of things you really need to think about. What experiences does your brand or service or product provide? And the final thing, which is very important in India, and I think that is the symbolic value of your product. And believe me, if India was only price conscious country, then we would not have those kind of weddings that we have in the world. We are an extremely symbolism oriented country. We have self-directed symbolism. We always ask, what does this mean to me? But there is a predominant aspect of Indian consumer who says, what does this brand mean to others? You know, neighbor's envy and owner's pride is such a powerful punchline for India, that other directed symbolism. And I think, are you offering that with your product? Are you offering that with your brand is so important in context. And so when you think about these challenges as India provides us in terms of, you know, so when we go to health system, as what Professor Padmadas was talking about, we just don't, in Ahmedabad, we just don't go to, you know, the VS hospital because it's a general hospital. We generally don't tend to go to the civil hospital, but we would try to go to the SAL hospital because, well, you know, what will others think of me is a very powerful motive that drives us in our healthcare choices also. As Professor RobAngell was talking about, in terms of our irrationality of our retail choices, we do that. You know, if suddenly a particular chaiwala becomes very prominent in terms of in Ahmedabad, I'm not talking about the PM, I'm talking about, you know, a particular type of chai stall becoming very important in India, in Ahmedabad, everyone flocks onto it. And I've done the same when I was in Ahmedabad. And so, you know, you need to really understand the nature of your product. You need to understand the functionality, the experiences, and the symbolisms that people attach with your products and services and your organization. That would drive you to actually manage these global challenges that earlier were talked about. So I will finish here. Thank you all very much. And what we will now do is we will have a good Q&A with the experts that are here. I will take those questions and I will then pass it to the experts to have a chat about these aspects. And let me start with the first question that was asked. Jane has privately answered that question, but I think Jane and Rob, I would both want you to possibly pick up on this because this is something about culture. And the question is that, you know, how, in a way, with the smaller families, we are becoming, as we are seeing, Jane was talking about, you know, number of kids are, the number of kids we are having is going down, especially even in India, and that is significant. And India has always been touted as a collectivist society. But now, if you look at the family size and the nuclear families and the urbanization, India is moving towards becoming an individualistic society. And if that is the case, you know, what kind of possible challenges in terms of the population is changing as population itself? So how are we going to manage that? And Jane and Rob and Sabu, how would you want to talk about this? Jane, over to you.
Thank you. So I think the question actually said, to what extent is that move from a collective to an individualistic society associated with the demographic transition? And I would say absolutely. So Sabu is a graduate of the Dutch demographic tradition. And there was a Dutch demographer called Ron Listark who wrote about the second demographic transition. So what I showed you was the first demographic transition, really, the move from high mortality and high fertility to low mortality and low fertility. And the second demographic transition is actually all about changing family structures. And running alongside these changes are changes in divorce and cohabitation and remarriage and living apart together, lots of new norms. And these are related to that shift from a collective to an individualistic society. That's happened in Western Europe and in North America very much from the 1960s onwards. And you can see it happening today in India and in other parts of the world. I think particularly the example of South Korea is a culture where the government is hugely concerned around this shift to an individualistic culture, and the fact that people are not marrying and are not having children and are not doing what one might think of as their familial duties or their societal duties. So I think what we have to do is to find a balance between those two cultures, which I think we are starting to do now, that we recognize that people actually take value from individual activities and being individualistically motivated, but there is also a value to the collective. And I think you started to touch upon that, Paurav, yourself, around it's not just what I do, it's what other people think of me, but also what my community thinks of me, and also what I contribute to my community. So I think we're probably, I mean, I'm not a sociologist, but I think that sociologists now are starting to think that these two almost black and white versions of society are probably outdated, and we need to have new conceptualizations of society. Sabu, you're smiling.
Yeah.
And you're mute. Well.
All right. Okay. Sorry. I'll just reflect on that. I think, absolutely, I think this is a very important point. I mean, for a second, I was thinking of the business demography being really, really prominent, because, consumption is nothing, any changes in consumption or consumption behavior is nothing, but it's a function of changes in population behaviors and composition and changes. So, there are, Professor Jain and I had a unique opportunity to visit some of the real estates focused on aging population in China. That was really not, and that's probably happening because, when people cross certain age, then the consumption patterns change, the infrastructure that they need within the household changes, even the way that the transport systems operate will change. So it's very much linked. But as Jane mentioned, that Korea is one of the countries that actually on the planet which is really going down in terms of the population. So if the trend continues by the end of the century, Korea, you would hardly find South Korea on the map, because that's how it is. And many of the Italian villages and German villages are now empty. So India has that unique opportunity, in terms of, harnessing that demographic dividend, as well as the aging dividend, because there is that phenomenal opportunity. And because this also happens in the process of that transition that we tend to learn, whenever we look at the Western countries, and if you look at the transition is usually slow. But when you look at the other side of the world, like India and many other parts of the world, like the transition is much quicker. So that means there is a lot of experience that you can actually gain from looking at how the UK is managing its aged population, and it's tremendous. I think like for the UK National Health Service, I always tell my students that how important the service is that in terms of take care of the people. So it's really much wider. But it's a very important point.
But as we are moving from this, if 1.5 billion people move from being collectivist to individualistic, more towards being individualistic, Rob, what kind of consumerism would we see? What kind of, the energy consumption, the health-related consumptions, what are we going to see?
We're going to see a much less sustainable ecosystem. We're going to see people consuming way more than they need, buying more than they need, and whilst that fuels business and revenues in the short term, there's an underlying cost to the environment and to societal fabric that pays the price. And we've seen that in other parts of the world. I'm not sure if it goes that far though, Paurav. I feel that there is a halfway house, and it kind of slows down that trajectory to individualistic society.
And I think we don't all have to follow the same path. So as Sabu says, transitions maybe go at different speeds in different parts of the world, but there's also learning from different parts of the world. So if we take the move to communication, Africa missed out telephone lines. They don't have any poles. dotted around the country with telegraph lines on them. They went straight from 0 to mobile.
Yeah.
You know, and I think Rob is absolutely right. If we mirrored the shift that went on from 1950s America to 2010 America in terms of consumption, in terms of meat and cars, and the world would not be able to sustain that. But we're seeing a backlash now. So we know that in Europe, actually, the young people in Europe are actually returning to a collectivist. So Greta Thunberg, you know, we're going full circle. So that's why I was saying we need a new conceptualization. These aren't two different models where it's a linear transition. We actually probably want to be individualistic within a collective. I think that's what most young people today want to be both. So they do want their trainers, but they also want to save the world.
That's right. So one of the great privileges the four of us have is that we get to engage, and we have done over many years, with young people. Now, whilst we see the same cultural values that are obviously inherent in them, that they're given by their family, by their society, there is a fundamental shift in the way that younger people are behaving and acting. And you know, 15 years ago, I don't see the same students as I see then. And actually, it's a good thing, as you say. They care more about the environment. They care more about society. They're more collectivist than they probably were in my generation. And I think you're right. That's a beautiful thing to see, and it's a privilege, actually.
Absolutely. Wow. What a fascinating talk. And we will have to continue that, but there are a number of other questions that are kind of, you know, as interesting. So the question from SB Dangayach, number of questions, but I'm trying to collate them. In terms of the aspect he's asking around is that on the basis of health systems, particularly, and some of the things that are mentioned by SB Dangayach are that you know, longer life or longevity alone cannot mean better health, I think, and that is very, very powerful statement. And so we will have to change our matrix in terms of how we think about health. And then other thing about in terms of, you know, what about the wellness-centric approach rather than illness-centric approach that has been used currently in many governments across the world? And particularly when thinking about that patient centricity, you know, what is reliable evidence? So there are a number of various aspects that SB Dangayach has raised so Sabuji, would you want to start?
Yeah, I think I have really picked up a few points. I mean, thank you for your question. I think one of the things that I would like to reflect on is that regarding the evidence that we're collecting, you know, because I think for a pandemic like this, I think, of course, you will have to really be very careful in what you're doing, and you know, you have to really peer review your research and a lot of, so that's how the evidence is generated. But also equally important is that to reflect on the, you know, the macro trends that Professor Falkingham was mentioning regarding, you know, for example, all these changes are indicative of the fact that we would be able to really do some kind of risk profiling by looking at the population structure, composition, and so on, and distribution, and so on. So that's one thing. Second is that absolutely from illness to well-being is actually the move. Indian government has already taken that forward. Many Western countries are really practicing that, but it is not really that going to be very easy, especially when you have a dual burden of diseases. So that means, like, you know, in this case, particular case is actually we have both infectious and you know, non-communicable diseases. That's going to be quite challenging. So there is, I mean, you have to really, so how you integrate well-being into that kind of you know, into that disease framework is very, very important. So where do you start? So do you start implementing well-being towards, you know, towards older age, or do you start early? And, you know, I think Jane is smiling. I know that Jane is really working very hard for the university in her leadership as the vice president, ensuring that, well, everyone, you know, gets that well-being in their, you know, because well-being equally applies to workplace as well. So it is a very holistic concept. It should not be it should not be just confined within the health sector. It is really, even at household level, I mean, this applies regarding, work time, etc. So it's, I mean, I completely agree that we need to really move towards that one, and an integrated approach is what is required. There was one point regarding the data, so the different, I think the allopathy and so on. So I would like to really quickly reflect on what Vinod Khosla said, that, for instance, I think he's someone of Indian origin, an American entrepreneur, who said that, well, in the future, in the next 25 to 50 years, if you put all the data sciences that also includes, like, our own discipline like demography and all those kind of heavy data sciences will really play a very prominent role. I think, in fact, the answer is that will do more than all of the biological sciences put together to understand the pandemic. So we have to, this is the time to really integrate disciplines like behavioral sciences, business studies. I think so. So there is no. So it's quite crucial. I'll stop there. Thank you.
Oh, super. Thank you very much, Sabuji. I think it's the whole idea of amalgamating the sciences to actually come to a very, these are thorny issues, and they cannot be solved by just one science. It has to be a work together. And I think that is something which is what is happening at Southampton also, with number of interdisciplinary groups that are happening, and around the world also, for sure. And there is a very interesting question, and I would like to pose this to both Sabuji and Rob, particularly in regards to Dr. Jatin Pancholi has asked this, in saying that, emerging economies like Bangladesh or India or Pakistan and Sri Lanka, in many other parts of the world also, prioritizing on educating masses for cleanliness and hygiene, is a significant indicator of health and well-being. And I think, how do we manage that in these countries? Because these are very densely populated countries. And so what is going to happen is any pandemic ever arriving would spread very rapidly. And so how do we create a mass level education of hygiene? And in particular, in a way, we have seen in India, in a way, Sabu and I have been in India, lived in India for a while, and we know that we would like to keep our houses clean, but whatever happens outside the house is a different story altogether. And so how do we bring that very interesting idea of the world is my world, Vasudhaiva Kutumbakam, the family is, world is my family. How do we nurture that?
I think, Rob, do you want to answer first, or shall I just take it? I mean, because, okay, right. So I think at the point, Bangladesh, for instance, all South Asian countries, as well as Africa. I think in Africa, one thing that really struck me was in Rwanda, where every second Saturday, I think they would really go out and do a cleaning of the road. So even if you're the president of the country, and if you step outside, you will have to contribute to community cleaning. And so that cleaning, it's very much also in the mind of people, and again, for that one, always the health sector is, the poor health systems are burdened with that task of public health and hygiene. But it is not just confined to health sector, but it is definitely, businesses, local businesses. So we do see a lot of billboards on mobile phones everywhere, all over the world, like all major telephones, but we don't really see many of these kind of public health messages. So marketing, I would say health marketing and health literacy are paramount. I think, it has become even more important now than ever before, because of the pandemic outbreaks like COVID. So health marketing is certainly one, and health literacy. Health literacy is not just saying that, do you know, have you heard of this? But what do you know about this? So it's actually the functional knowledge of health aspects is very important. The other thing is that actually teachers and parents, they have a big role. So, so we follow our teachers, and as teachers, we have that responsibility to. So it starts from schools, from to the wider society. Thank you. So Jane.
Yeah. So I just wanted to say that this is a fantastic opportunity that we have right now. We should always use a good pandemic for good. Nothing like a burning platform. And actually, right now, I think the message around washing our hands and is out there, and all school children across the globe are learning about this. If they can then take that forward into everyday life beyond the pandemic, that will have an enormous impact. So I had the benefit of supervising a PhD student who was working in MATLAB in Bangladesh on the WASH initiative, which was about increasing the use of hand washing. And they had a project in an area in Bangladesh where there was a big public health campaign on increasing the use of hand washing and distributing free soap to households that had never previously had. So it had an enormous impact on infant and child mortality because it reduced diarrheal diseases. So although people are dying from COVID today, more people are still dying from diarrhea
Absolutely.
and infection. So I think we shouldn't forget that. So if we can use this pandemic to increase health literacy, it can actually have a long-term positive impact.
How amazing.
Thank you, Jen. Just quickly to add one more point, that these changes are happening so fast in countries, like even including India. Like, Ahmedabad today, I think, or Surat or, Mumbai today is totally different from, 30 years ago. So that changes are happening, but rather slowly. In fact, our Honorable Prime Minister of India, will initiated the Swachh Bharat. That means like Clean India campaign. And well, it was really, it was sent out more politically, but I don't know whether there was a follow-up and whether there was the evaluations and so on. So we also need to not just introducing population level interventions and schemes, but we should also take that responsibility to evaluate these, how, whether this has been effective or not, because otherwise we'll make assumptions that, people understand everything.
Yeah.
Can I add here? So I agree with health literacy, health marketing. I think that the key is sustained messaging, though, because if we take the broad evidence that it takes, on average, let's say 66 days to change somebody's habit so it becomes an automatic process and function, it means that in areas that do have dense populations, it's not okay to just do an advertising campaign. It's not okay for teachers just to wash hands for the first sort of couple of weeks of the year. This has to be a long-term initiative and objective, which becomes automatic rather than manual.
How amazing. Yes, absolutely, isn't it? This is somewhat answers one of the latest question that was put in also by Pavan B, who said, Pavan said that, it's such a challenge for India because of the number that we are dealing with. The law of large number comes in picture, and that's rural to urban migration. There is an education challenge. And so should we then go ahead with, a kind of a draconian style system which Singapore or China has adopted around it, or should we do it a more democratic way in India as we tend to do it, which is messy in nature? And I think your approach of that sustained, continuous engagement, I think, drives that very well, Rob. I think it is very important. And there are two things I remember particularly, which I want to mention. I would suggest participants in this panel to possibly, when this panel is over, to actually go to and type in Google Southampton Life Lab. And it was a phenomenal initiative by University of Southampton on teaching and educating secondary school kids or school-going kids in terms of how to build life skills around hygiene and health. And I think it's a fascinating thing. And again, there would be ways in which we can connect on that part. But also in India, an academic actually in a city of Coimbatore in India, who is with us right now on this call, did a marvelous societal campaign around, Swachh Bharat, and they continued. And their students, it was a GRD Institute of Management and Professor K.K. Ramachandran, who is here with us, who did this campaign. And it was such a powerful campaign for the city, wherein they cleaned the streets. And once students started doing it, a lot of people saw it. And remember this other directedness of Indians. When we see others doing it, then we will join in.
That's right. In fact, I think the campaign started, the Swachh Bharat campaign actually started with Dr. Ramachandran, Professor Ramachandran from Coimbatore. That was really spectacular. And there is that documentation.
Yeah.
So yeah, I think
he asks this question to you, Sabuji, in a way. So Dr. Ramachandran has posed a question. He's saying that a coronavirus is likely to become an endemic like flu. And vaccine may not be able to stop it. So what is your view on that?
Yeah, this is a very tough question. I think I don't have that, I can't answer on that virology or, molecular biology area. But I think one thing that's clear from the history is that these viruses, I mean, some of these, so the unlike flu viruses, the current virus, COVID virus, is more contagious, highly contagious. The infectivity rates are very high. That's already in the population. So that means there was an assumption of herd immunity, even including countries like Britain, I think initiated this herd immunity concept. But that was actually too early, too soon to really start. So the question is that, well, the probability that this virus is going to be endemic in our physical environment is going to be very high. There is also something called a syndemic interaction. So that means like this the virus that is really in the environment could actually potentially interact with other agents of, like vectors, whatever the other viruses that are endemics that are already in the community. And if they mutate into a new strain, we are confronted with another big challenge. And the reason why I say that that we will see more of these outbreaks is because of exactly what Professor Jane Falkingham said. It's all about, everything is related to population growth and the environment, the larger environment, because like urbanization is happening so rapidly, and these are really well urbanized countries. I think some of like Brazil, 90% of the population live in urban areas. So urbanization is 90%. Latin America is full. And where do you see the global share of mortality now? It's highest in Latin America. These are all happening in urban world. So the way that urban areas are managed have become a bit unruly. And air pollution is another significant challenge. Water sustainability. So these are really significant challenges, not just confined to India, but globally. But to answer that question, I think we will be in this kind of state of uncertainty and complexity for the next 6 to 12 months before we understand the further about this virus. One thing that we know is that the genetic diversity is not really that it tends to really behave in a homogeneous manner. But what the US now reports and a few other countries which experienced a second wave is that there is a potential new strain. So this is a question that needs to be answered by specialists. And of course, we are, everything that whatever we contribute to that discussion is also important.
How fascinating. But I would also suggest possibly participants to type in again in Google, Professor Holgate and his presentation at University of Southampton, which he delivered very recently, only last week, around the pandemic. And it is, in a way, he talks about it from a medical sciences perspective. It's a 15-minute talk, absolutely dense, full of fact and full of absolutely amazing information about COVID and how that virus is spreading and what it is doing to human body inside and how it can move forward. Some of the absolutely amazing insights are there. So please look into Professor Holgate's presentation on YouTube. It's available on other platforms. It's available. So just if you type in, you will be able to find it. We're coming to very close to the closing of this panel session. And Rob, this is a question that has been asked again by 2 or 3 different participants. And Jane, I would like to involve you also, because I'm going to bring in 2-3 things together here. One is that India obviously is slowly but steadily becoming a superpower in its own right. It's already there in South Asia, but in Southeast Asia, but it's still a bottom of the pyramid market. It's not a very rich market. So there is a large middle or lower middle class, and then you have, fair few very, very rich people. But so India is going to become a possibly global superpower as Pinky says. And in that sense, but it is also bottom of the pyramid market. And so, and combining that with Amar's last question, who says that, so do businesses then need to continuously pivot themselves to manage those challenges, or can businesses just continue with them because India as such is big enough to manage everyone or give something to everyone? So I don't know, Jane, would you want to start with the big challenge of India as a global player? Rob, possibly on the business side of it?
Absolutely. So I think this is India's century. There is absolutely no doubt about that. India is a world superpower already for us. And I'm not a marketing person, so I had never heard that India was a bottom of the pyramid market, because I would say India's probably got a rectangle, or maybe with a slight pointy top. But I mean, Sabu and I were looking at the Indian middle classes, what, 10 years ago?
10 years ago,
at
that's
the
right.
University of Kerala and at ISEC in Bangalore, we had a project looking at the rise of the Indian middle class. The Indian middle class is here already, absolutely. I think if you think about it, India is the size now that the whole of the world was in the 1930s, 1940s. So actually there's not one market, there's always going to be many markets. I think the world is transforming, India is transforming, and in 2050 there'll be a different set of markets. But so I'm challenging back to you, Paurav. I don't think it's a bottom of the pyramid market. I think India is already steaming ahead.
Yeah.
Go ahead, please, Rob. Rob, please.
Yeah, so Paurav, to take a slightly different take here, yeah, definitely there's ample opportunities for business to capitalize on the changing demographics, socioeconomic status of the society. But at the same time, that comes with quite a great responsibility. And I sort of have my pro-social hat on here. When you have people, obviously, that are bottom of the pyramid in their class, if you like, then they are going to aspire to move to the next class. And the way that we move to the next class is how we signal to others by the things that we have and we own and the things that we do. And you run the risk of, as a society, of people therefore working and living outside of their means because that's what they want to do. But organizations, businesses also can take advantage of this. And that leads to instability at that bottom level of society, people having debts that they can't repay. And that puts a burden on the taxpayer and on the government, as well as on the individual. So yeah, with that changing dynamic also comes great responsibility.
Yeah, I think just to really add to that is that I always refer to these four letters. One is L and the other one is U and the other one is V and W. These are the the four shapes that you refer to when economic recovery of a pandemic or a recession, right? So many countries will experience a U-shaped recovery. I mean, there's no doubt about that. And L-shaped is rolled out, but I think the V-shaped recovery is possible for India. And there are two countries in the world. Several people have asked this question to me, and I think India and China, undoubtedly, in terms of COVID, this recovery is going to be, it'll happen very instantaneously because of the population. Because again, going back to the population size and the way that. But the problem in India, Jane, I can completely agree with Jane that it's already in an emerging and super position. I mean, in terms of economy. But I think the challenge in India now is that actually the inequalities, the divide between the rich and the poor. So what happens, that's actually a characteristic of a transition economy. As the economy grows, then we tend to leave behind a lot of people in poverty. I think that's where the country would need to really pay attention. Then the other thing is that, well, let me be very frank and very open. The last 5 years, this decade was a golden opportunity for India to really start seeding the investment for harnessing that demographic dividend. So there were lots of potential opportunities for investments, for job generation, economic growth. And I don't mean to say that these have not taken place. And then unfortunately, for various reasons that we had, several, I think India probably in the last 3-4 years, particularly tried to change and reduce corruption and lots of movements in that movement. I think introductions like demonetization and also, a few other political movements have actually stalled. And also, I think in a way that, well, in terms of confidence, what India needs to do is actually to increase the confidence, boost the confidence of investors. Foreign direct investment is going to be very, very crucial. Now, India is now the second largest investor of the UK, in the UK. That's what I understand from my colleague, Mr. Amajit Singh. And that was really quite surprising. So there is that flexibility is very important. Second, I think the best way to really manage the population is actually to provide the right skills and skill-based education. And the new national economic policy that India has now recently introduced has that tremendous scope. And I think if we manage this new economic policy, engaging that more global and making so India becoming part of that global community of knowledge. And that is the solution. And I think we are also glad that we have Professor Jane Falkingham, who is actually leading the India strategy and the India development. I mean, in fact, she's also the executive director of the India Center for Inclusive Growth and Sustainable Development. Our research is completely focused on strengthening and contributing to whatever, and also learning and sharing and learning. I think that's one of our objectives. Thank you.
Thank you very much, Sabu, for that reflection. And on that final reflection, I would want to thank everyone, particularly AMA, for organizing this event for us and everyone to participate. And I would like you to, I've shared some links on our chat box in regards to the final link is to our India Center at Southampton, because you may not know, but Mahatma Gandhi actually entered in as United Kingdom for the first time via Southampton. And so, there is a special place for Gandhiji in Southampton. And in last year, when it was his 150th anniversary, at that point in time, 2 trees were planted in the United Kingdom. One was planted at the High Commission in London, of Indian High Commission in London, and the other was at University of Southampton. And we are very proud of that connection with Ahmedabad, with Gujarat, with Gandhiji. And, we would want to continue working with Ahmedabad Management Association and other entities within Gujarat, particularly, to be part of your growth journey. So please connect with us through India Center, and thank you, everyone.
Thank you, Professor.
Thank you.
Are you able to listen to me, sir?
Yes,
yeah. We can listen.
Thank you. We have an extraordinary panel today addressed on various macro issues and challenges being faced by the global economy. And particularly, Mr. Jain addressed the demographic challenges of the world, and healthcare issues were addressed by Professor Sabuji, and the human behavior aspects and supply chain management issues were addressed by Dr. Rob, and Professor Shukla has addressed most of the marketing issues related to corporate world. And thank you very much, all of you. We are really fortunate to have such a distinguished panelists in our webinar today. Sir, before we go off, I would like to share a little experience of mine, how I have gone through as an SME entrepreneur post-COVID period, so that you get some insight into the micro level, what's happening kind of thing. Sir, my own experience I want to share with you, because I feel enlightened post-COVID actually. Okay, we were, because in India, most of the SME sector is the worst affected sector during because of the COVID. And Government of India is trying to give all kinds of help to the SME sector to come up, because they employ the maximum in India. And they are also the leading export earners for the country. But sir, before we go on COVID, believe me, a day before, I have declared a special bonus to my employees. Okay. And we went through COVID. There is a migration of labor. I addressed it by retaining all my labor not to move from my premises, by providing rationing and all the financial support to them. I have not proposed any cut in their salaries. I paid fully to them. I took a rest for about 2.5 months. And after 2.5 months, it was really a challenge how to come back to the normal. So therefore, after taking such a long rest, I have become much more vigorous in terms of putting my efforts. Okay. And the attempt was to come out of this challenge. So this, and also you can also see it as an opportunity and try to be a better organization kind of thing. Okay. When we started with the first unlocking period, most of the units were closed for want of labor, because labor were migrated back to their villages, and input cost is the lowest that time. Like there is no demand, there is a demand contraction. At the same time, there is a supply constraint also, because everybody was through COVID lockdowns. We started producing much before. We went on producing at low cost, and after a month when the demand generated, we could cope up with it. Okay, and not only that, sir, I have taken care of all my people with empathy, and believe me, I'm going to declare a double bonus during Diwali time in the next 20 days, kind of, to my employees.
How amazing! Okay. How amazing!
Wow, yeah, that's really impressive. Yeah,
yeah, and sir, we have become much better organization post COVID. All the inefficiencies we have sorted out. Our recovery of payments is much faster now. We are more healthier now. We are positioned in such a way that we will take up any kind of challenge in the days to come. We are also addressed to, because movements are very restricted. Therefore, we are giving a lot of trust on digital marketing. We were never thought of social media. We are in social media now, and banner advertisements, web designs, all sorts of things we are doing, improving our processes, adopting the right technologies. So we're doing all sorts of things, sir. It's a big challenge, and most of the companies in India in SME sector is addressing these issues for future in a better way. This is where Professor Shukla has addressed us on the strategic inputs about the business organizations. Ultimately, it's the value for money. If we offer to customer, he is going to be with you, sir. This is That's what we experience, sir.
How very wonderful.
Very nice, yeah.
A perfect end to this wonderful seminar. Thank you ever so much.
Thank you, sir. Thank you very much. Thank you all the panelists.
Thank you.
Thank you, everyone.
Right. Everyone, thank you again. And from Southampton, and we wish to see you at some point in time. Thank you. Bye-bye.
Yes, thank you. Bye-bye.
Thank you. Bye-bye. Bye-bye.
Thank you very much, everyone. Thank you, Paurav sir. Thank you, Rao sir. Thank you, Sabu sir. And thank you, Rob sir. I missed to thank Jane madam on behalf of AMA. Thank you, Rao sir. Yeah.
Thank you.
Your permission. See you, everyone.
Thank you. Thank you. Please stay safe. Thank you. Bye-bye.
Take care.
Thank you.